Hi Jim, my name is Alyssa and I'm going to be going over these liver labs that the doctor ordered for you, okay? We're going to start with AST and ALT. Both of their normal lab values are 10 to 40. The purpose of the AST is to detect damage to the liver, heart, muscle, and kidney, whereas the ALT is liver specific. Factors that affect these results are Tylenol for both of them, but also for AST is strenuous exercise, and then ALT would be aspirin therapy or lead ingestion. Signs for increased levels for the AST are fatigue, weakness, nausea, and jaundice, and then decrease would be muscle weakness, fatigue, or low energy. And then increased for ALT would be jaundice, loss of appetite, or dark colored urine. And then for decreased levels, fatigue, generalized weakness, and then nutritional deficiency. Now for all of these tests moving forward, I will report any abnormal findings to the healthcare provider, as well as going over any treatment options if anything does become abnormal. So I won't repeat that going forward, but that's for all of the tests. And then also during the test, these are all via puncture. So for all the tests, you might have some discomfort with the tourniquet and the needle puncture, but I'll go over some before and after the test implications. So before this, there is no food restrictions or fluid restrictions. And then during, we will be taking about 4 milliliters for both of those tests. We will put direct pressure for those, and then you can resume any medications discontinued before that test. Next, we have ALP, which is 50 to 100 units for normal value. The purpose of it is liver and bone disorders. A factor that can affect the results would be recent ingestion of vitamin D and fatty meals, and then increased levels, bone pain, itchy skin, and jaundice. And then decreased levels would be numbness, tingling, or fragile bones, but that is rare. Now with this test, you do need to fast for 8 hours before the test, and again via that puncture with the same 4 milliliters, and then direct pressure will be applied to the site until the bleeding stops, and you can resume your normal diet after that. Next, we're going to go to direct bilirubin and total bilirubin. Direct bilirubin is less than 0.5, and then total is 0.1 to 1.1. For direct, it checks the bile duct blockage, and then for total, it assesses the liver function. These can be factors that can affect these tests are any barbiturates that are taken, or if the sample is exposed to direct sunlight, as well as any liver toxic drugs. Signs for increase for direct are jaundice, dark urine, and pale stools, and then often no symptoms for decreased, and then total is jaundice, itchy skin, and fatigue, and again, clinically insignificant decreased levels. And for this one, you do need to fast for at least 4 hours, but there are no fluid restrictions for you, and avoid alcohol for 24 hours. During the test, we will again take that 4 milliliters and put that pressure on there, and you can resume normal activities unless told otherwise. And then we have albumin, 3.5 to 5.5, and that is for nutritional and liver status. Factors that affect results are last trimester pregnancy and prolonged bed rest. Signs and symptoms for increased dehydration, dry mouth, fatigue, decreased edema, poor wound healing, and fatigue. For this one, stop taking any anabolic steroids, androgens, growth hormones, or insulin before the test. And we will also be taking 5 to 10 milliliters for this one. And applying that pressure. Eat a high diet if you can after, unless you're not allowed to. And then we have total protein, which is 6 to 8.3 normal value, and that's for nutritional status and chronic illness. Factors that can affect it are cell-damaging drugs or any contrast that you were given before the test. Signs for increased levels would be dehydration, fatigue, and joint stiffness. Decrease would be edema, muscle wasting, brittle nails, and hair. And then before this test, there is no fluid restrictions. There might be drug medicine restrictions. We'll check with the lab. And then for this one, we'll take about 7 milliliters. And you can resume any medications that were discontinued. Bruising is a minimal risk for all of these because it is a puncture. Any questions? No? Okay. Thank you.